My name is Dr. Diana Olita'a. I'm a pediatrician, meaning a children's doctor. I have an interest in, especially in children with heart conditions. So at the Port Moresby General Hospital, apart from looking after children with other conditions, I'm also in charge of looking after children who have heart conditions. So I run our children's heart clinic, those children who have heart conditions, and we've discharge them from the ward and they come back for follow-up at our clinic. I see them at the clinic, and also I do the heart scan clinics as well, where we diagnose the children with heart conditions. So working with children with heart conditions can be challenging and also rewarding as well. So challenging, when I say challenging, like some of the challenges we face are diagnosing children with heart conditions early, so they don't come present to us with like complications of the heart condition. Because most time we see children with who come to us when they already have a complication. Another challenge is getting children to take their medications, because some of them will live on these medications, and it's hard to, sometimes, children, they'll be tired of drinking tablets every day, so just getting the parents to encourage them to get their treatment also is also another challenge as well. When I say rewarding, the rewarding part is for those children who have heart conditions and can be fixed through surgery. When we see them initially with the underlying heart problem, they're not doing as well. So they are not growing well, they come in with recurrent chest infections. And when they go through surgery and after surgery and we see them, they're well, they're thriving, they have a second life at church, that's like rewarding for us, seeing them thrive and do well in life. In children, there are mainly two types of heart diseases. The congenital, meaning they're born with a heart condition, and then acquired, meaning they develop it after they're born. So with congenital heart defect, it could be a problem with the structure of the heart. So there could be a hole in the walls of the heart, or problems with the vessels that leave the heart. For acquired, it's more infection. Rheumatic heart disease is the commonest, and this infection usually affects the valves of the heart. So it usually comes about after a sore throat. So risk factors for children getting congenital heart defect. Firstly, mothers who have diabetes in pregnancy, so high sugar levels during their pregnancy, their babies are more at risk of getting a congenital heart defect. Also mothers who may have developed an infection during their pregnancy, because the heart usually would develop in the first few weeks of pregnancy. So if they develop an infection during that time, it can affect the development of the heart, and these children can get congenital heart defect. Other things that can also put children at risk of getting heart conditions, certain medications which may be prescribed for doctors for certain conditions, and also recreational drugs, alcohol, smoking. If mothers are taking this during their pregnancy, puts them at risk of their children of getting congenital heart defect. And then genetics also comes into play as well. For acquired heart infection, especially rheumatic heart disease, having a sore throat from this particular bug we call streptococcus puts them at risk of getting rheumatic heart disease. Okay, so starting with congenital heart defect, the condition where they're born with, so some of the signs that may suggest that a baby has a heart condition is that they have fast breathing. Mothers may notice, like after 2 months after birth, they notice that the baby's breathing is faster than usual. Their babies may not be growing well, so they're not putting on weight. They also may see that their child has a recurrent chest infection. So if they notice this, then their baby may have an underlying congenital heart defect. For an acquired infection like rheumatic heart disease, the most common thing that they may present with is heart failure, and symptoms of heart failure are like shortness of breath, and they get tired easily. The normal things that they would do, like activities they would do, they won't be able to do now. They will get tired easily. They can have chest pains. They can also have swollen limbs as well, and that may suggest that they have an underlying heart disease. For parents who have children with heart conditions, I think one of the most important things, especially for those who need the medications to help their heart, is to encourage them to take their medications every day and on time, and also to come back for their reviews when they're scheduled, because we monitor them at the clinics, we see their growth, and if they're not growing well, then we can advise on what to do. So it's important that they bring their children for their regular reviews, and we get to see them, monitor them for complications that they can get later on in life. And then the other things, like for children who are also in that stage where they're still getting their vaccinations, it's important they continue with this getting vaccinations as well, because it protects them from other conditions that they can get throughout their childhood.